Hello, my name is Chanel Silas. I am a junior psychology major from San Francisco, California, and my mock proposal is on ADHD and play-based therapy. So here is some background about ADHD. Attention Deficit Hyperactivity Disorder is defined as a brain disorder marked by an ongoing pattern of inattention or hyperactivity impulsivity that interferes with development. There are three types of ADHD that would be inattentive, hyperactive, impulsive, or combined. There are a couple of treatments for ADHD, one of them being medication. There are two different types of medication. There are stimulants and there are non-stimulants. Stimulants have a calming effect and they are believed to increase brain levels of dopamine, and between 70 and 80% of children with ADHD have fewer symptoms when on stimulants and they're fast acting. Then there are non-stimulants, and these are useful to those that do not react to stimulants well, and they don't work as fast but can last up to 24 hours. There's also behavioral therapy. So the advantages of medications are that they can manage the symptoms of ADHD, but the effects of these medications vary from child to child. Medications can be very costly, and there's a possibility that the best medication on the market has not been approved by the FDA and is still in the experimental stages. So, for the hypothesis, the researcher will be trying to figure out whether physical play among peers during play-based therapy sessions combined with family counseling is the best treatment approach for treating the symptoms of and changing the brain activation patterns associated with ADHD. So there are two studies that really focus on play-based interactions. Wilkes-Gillian in 2016 examined the effectiveness of play-based interactions in children with ADHD, and the findings from the study do support that the use of play-based interactions using parents and peer involvement enhance social play skills. The only downside to that is that non-pharmacological interventions are very difficult to design and are also very difficult to evaluate. And then Cordier and Monroe in 2011 studied pragmatic language abilities of children with ADHD, and the findings showed that children's pragmatic language significantly improved from pre to post interventions when engaged with peers or when engaged with parents. So for the methods, following ethical approval, the study will consist of 100 children between the ages of 10 to 12. 50 of these children will have ADHD and be receiving some type of treatment for it, and 50 will be without ADHD. This sample will be recruited from pediatric services and schools in the Hampton Roads area. All of these participants must have the consent of their legal guardians, being that they are minors, and the criteria to be included in the study will be a formal diagnosis of ADHD made by a pediatric physician using proper protocol. The instruments of the study will be two different types of tests. So the SMAPs and the PP, those are pragmatic language tests. Those will be given pre and post intervention to assess the language skills of each participant. Though both tests do study pragmatic language problems and improvements, they both do hone in on different parts of pragmatic language. There will also be blind raters used to assess and score social behaviors that are observed before, during, and after these interventions. Lastly, the procedure for this experiment. Each participant will be observed pre-intervention just to see where their language skills are at, where their social skills are at. Then during the intervention, their interactions and language skills will be observed and recorded. The participants will be observed post-intervention as well to examine whether their behaviors or language skills have improved. This will continue over a 3-month period. That's just enough time for them to not only become used to their surroundings and the people that will be interacting with them, but once they kind of ease into that process, it's going to be a lot easier to have a more genuine interaction with their peers.